This is Dr. Meyer in Sacramento, California, and this week I'd like to talk to you about getting a doctor that will work with you. We've covered choosing a doctor and how important that is and having a doctor available. But sometimes doctors who are blamed for the high cost of medicine and health costs orbiting out of control are sometimes the best ones to reduce your health care costs. Recently had a patient, Mr. Allen, who had bad emphysema, and it was his medications that were fairly expensive, but his wife was losing her job because I think she had multiple sclerosis or something, and her insurance was paying for their medications. And so he went to the pharmacist, and the cost of all his medications would be about $600 a month, and he says, that's just about my entire Social Security check. And so we went over his medications and all the things that he needed for opening his lungs and bronchodilators and expectorants and so on. And we got things down with generic medications, and I wrote the prescriptions for replacements. He was very pleased the next time that when he got these filled, the pharmacist said that the expected cost would be about $200 instead of $600. So sometimes the doctor is the best one to look at it objectively and reduce it. Many times patients come home from the hospital and they've seen a lot of specialists and they have a large number of expensive medications. Instead of $30 or $40 items, they have $400 and $500 items on there. And many patients come to the office and they say they haven't taken any of these things to control their heart rate and so on because they couldn't afford it. And therefore the doctor was left to choose what's best for them, even though it may not have been his field, to bring the heart under control and bring the cost under control. This points out that doctors and patients, when they're jointly in charge, can reduce healthcare costs rather dramatically. They actually can do it more effectively than the government, the HMOs, health insurance, and so you really have to have a doctor you can work with and get these things under control. A small $5 or $10 copay really doesn't have any effect on the total cost. In my own instance, my family is on about 6 or 7 medications, or maybe it's 8. But the insurance companies list a price of close to $700 or $800 on this for every quarter. I go down to the local Sam's Club where the medicines are $4 a month or $10 for 3 months, and I get 8 medications for $80, which is even 1/10 of what the projected cost would be if I did it commercially. So it's very important to remain in charge and have a doctor that helps you stay in charge, and that would be the best control for healthcare costs. And we'll be looking forward to seeing you next week.